Okay, so today we are going to be doing some activities and lecture. It's not going to be all one then the other. We're going to be doing a bit of back and forth, okay? And so what I would like you to do, actually wait, okay. Musculoskeletal system. So everybody should have read the pages of chapter 15 that I gave to you on Friday, okay? Jenna, what is the purpose of our musculoskeletal system?
To support our body and like keep us upright. I don't
Okay,
know.
so one, it provides support. Good. JD, what's another thing? What else does our musculoskeletal system do for us, JD? JD, can you hear me? Maybe not. Isaiah.
It supports and binds tissues.
Okay, so we have support. That's the skeletal piece. What does the musculo piece do for us, Cody?
I don't know, like gives us stability,
Okay.
movement.
Movement, that's what we're looking for, okay? So the skeletal part of our body is our bones. That's going to give us structure. That's what keeps us upright. If we didn't have bones, we'd be a pile of mush on the ground, okay? Musculo or muscles is going to provide the movement for us. That allows us to walk. That allows us to breathe, our heart to beat, okay? So now what I want you to do, I want you to get out an ISN or a piece of paper, preferably an ISN. I want you to open chapter 15, part 1, and I want you to list these bones and label them, okay? So just write down 1 to 18 and label what bone 1 is, what bone 2 is, okay? I'm going to give you about 10 minutes. So it is 12:57. We'll say come back at 1:10. Don't leave the meeting, but at 1:10, I'll be calling you guys back in here in order to go over these bones, okay? If you have a question, type it into the chat box for me. Number 1 is the collarbone. That is the common name. In this class, I will be using the anatomical terms, but we are going to go over the common terms here, or the common names, so that you guys have an idea about where I am talking or what I am talking about when I use the anatomical structures, okay? So with that in mind, does anybody have an idea what number 13 would be commonly called, or your patella would be commonly called?
Kneecap.
Kneecap. Good job, Ella. Okay. Clara, I saw you raise your hand. What would number 10 and 18 be? They are called the phalanges. What would the common name for those two be?
Fingers and finger toes, I guess.
Fingers and toes, yeah. Okay, so your phalanges are your fingers in your hand and toes on your feet. Okay. Erica, what would number 8 be? Those are the carpal bones. Does anybody have a guess for that? Number 8.
Wrist.
The wrist. Yeah. Good. Was that you, Isaiah?
Yeah.
Good. Yes. So 8 is the wrist. Okay. So the carpals are your wrist. If the carpals are your wrist and the phalanges are your fingers, what are the metacarpals then?
hand and foot.
Hand, okay? So the carpals are your, the metacarpals are your hand, and the metatarsals are your foot, okay? Number 16 here, the tarsals are your ankle, okay? So the only other one that really has a very common name would be number 3. The sternum is also your breastplate, okay? So those are the common terms, okay? 6 and 7 together, the ulna and radius, make your forearm. Number 14 and 15 together, your tibia and fibula, make your lower leg or your shin. Okay. Now, a lot of people make a common mistake with tibia and fibula, and they call it the tibula or the fibia. Those are not bones in the body. Okay, it is tibia and fibula. Okay. So now we have labeled some major bones in the body. Okay. But bones are also classified, and these are the way that we classify them. Okay. You have a flat bone. Flat bones are typically pretty thin, and they protect organs. Okay. You're going to want to write these down because we're going to use this information here in a minute. Okay. Short bones, for example, your carpals, are pretty much a cube-like shape. They're pretty equidistant no matter how you look at it as far as height and length. Okay. So your short bones are almost, think of like a dice where it's equal sides on all sides. Okay. Your sesamoid bones, for example, your patella, are bones that are floating in the tendon. So they don't actually form a true joint with another bone, but they sit here in your tendons and they give you what's called a mechanical advantage. They make it so that your leg, your quad up here, can pull stronger on your leg and give you a stronger kick. Okay. Without this patella here, it'd actually be very difficult for us to do that type of movement. Okay. A long bone, for example, the femur, is longer than it is wide. Okay. An irregular bone has an odd shape to it. So you can look at the vertebrae here. You have the body of the vertebrae, and then you have all these little processes or projections off of the back. Okay. So an irregular bone would be a bone that is oddly shaped, we will say. And the last classification is a sutural bone. Now, we really aren't going to talk about these ones very much because sutural bone is simply where these plates come together and they fuse. Okay, that's what sutural bone is. So we're really going to be looking at these 5 over here. Okay. Now, what I want you to do is I want you to take these 5 classifications and apply them to the bones that you just labeled. So what is the clavicle? What is the scapula? Oh, that's another one that has a common name. The scapula is the shoulder blade, okay? So I want you to go through the 18 bones that you have labeled and tell me if they are flat, short, sesamoid, long, or irregular, okay? I'll give you about 10 minutes to do that. So it is 1:16. At about 1:25, I'll have you guys come back and we will go over this piece. Okay. Any questions?
What time do we come back?
What we're going to do now is we're going to go over this. Okay. Some of the more, we'll go for a couple of easy ones first. Karsten, the femur, what type of bone?
The femur is, well, let me find it. It is a long bone.
Long bone. Good. Okay. That was the example that was provided to you. I just realized that after I said it. Okay. Erica, what is the humerus? Or number 5?
I put long bone.
Long bone. Okay. So yes, it is longer than it is wide. Okay. Colby, what did you get for the metatarsals? Number 17.
I said short.
Okay. In this picture, I could see why you would do that, but it is actually a long bone, just like they are in the hand. Okay. It is a bit hard to see in this, that I will give you. Okay. But the metatarsals, number 17, are long bones. They are longer than they are wide. Okay. Lindsay Miller, what are the ribs? Number 4.
I said flat.
Okay. Did somebody else put something else for ribs? Absolutely everybody put flat.
I said long bone.
Long, okay. Okay. So the ribs are oftentimes fought over, okay? Technically, a rib is wider than it is long, okay? Because you're going across the body. But it is pretty thin, excuse me, and it does protect organs. So most commonly, ribs are called flat bones, okay? So patella was the only sesamoid bone. Flat, okay, here's another one. Number 2, the scapula or the shoulder blade. Who put, or let's see, Maria, what did you put for that one?
I put flat bone.
Flat, okay. Kevin, what did you put?
I said the irregular bone.
Okay, why did you put irregular?
Because I'm looking at the picture and it looks like it's shaped differently. Like, it's a weird shape. That's what I'm trying to say.
Okay. So here's another picture of your scapula, okay? This is a little bit easier to see, but you do have all these little protrusions on it. But this thing is nice, big, and flat, okay? However, it is an irregular bone because of these protrusions, okay? All right, good. So we're gonna switch up to muscles now, okay? So we've gone over the different types of bone. Now we will break it down a little bit further, and we'll talk about compact bone versus spongy bone and those things, okay, but not today. When it comes to muscles, there are 3 types of muscles. Number 1 here is striated or skeletal muscle, okay? Striations meaning stripes, okay? Excuse me. So these muscles are voluntary muscles. You have to think about it in order to make it contract. It's not like you're just sitting here and randomly your muscles or your arms and fingers are moving, okay? Now, there are medical conditions where that does happen, but that is not normal, okay? Number 2 here is smooth muscle. Smooth muscle is typically going to surround hollow organs, okay? Smooth muscle is going to help us push whatever it is through those hollow organs, okay? Number 3 here then is cardiac muscle. Cardiac muscle and smooth muscle are involuntary, meaning we don't have to think about it for them to work. I don't have to sit here and say, digest my food, stomach, now push that food through my intestines, okay? It's going to do that automatically when it is ready to do so. Same thing with the heart. The heart's going to beat. I don't have to think about it. I can fall asleep and my heart is still beating. That keeps us alive. That's a good thing, okay? Again, there will be medical issues that happen that we either have part of our heart die, which is a heart attack, or we could have some of our smooth muscles injured, okay? and then those things don't work correctly. Okay. Now, on your piece of paper, we are going to do a little bit of a drawing here. And my drawing is going to be rough because I am doing it on a computer screen. But here's what I want you to draw. Okay, so follow my example here. We are going to draw the, that was bad, don't do that. The myosin and actin sliding filament contraction, okay? That's a big fancy term for what we're doing called moving muscles, okay? So here is my actin filaments. And I'm going to draw in myosin.
Your screen is frozen for me at least.
Is it frozen for everybody else too?
No.
No, but are we supposed to be drawing this?
No.
on-
Yes, you are supposed to be drawing this. Isaiah, was it you that said it was frozen?
Yeah.
Okay. Is it glitchy or is it straight up not moving?
Just straight up not moving.
Okay, so am I on your screen, am I on the types of muscle or am I on the muscle contraction slide?
It's just all black.
Go ahead and try leaving the meeting and coming back.
Okay.
Everybody else, you guys should be drawing what you are seeing me draw here. Again, this is rough. And trust me, it would not be much better if I was on a whiteboard. I am not an artist. Whew. Okay. And then I want you to label your inside color. So for me, it was the myosin, and the outside color was the actin filament. Okay. So I underlined them over here for the drawing that I created there.
Is it okay if we just use pencil, or do you want us to color code?
It would be better to color code, but if you just use pencil, that's fine too.
Okay, thank you.
You give me a thumbs up if you have this drawing completed. Or I should say sketch, much more of a sketch than a drawing. Good. Okay.
What
So what we have here is the myosin head and tails being the red pieces and the actin filaments being the blue pieces, okay? When we contract a muscle, there's a cascade of events that has to happen, a series of events. A nerve impulse is going to be sent to the muscle, okay? Let's say we're talking about the bicep, easy one. Okay? So a nerve impulse is going to come down here into our myosin and actin filaments, and it's going to create a chemical reaction. We are not going to go into the chemical reactions that are created, okay? It can get very confusing even in person, and so I will wait to get to that, okay? What happens? That nerve impulse creates the chemical reaction, and that creates the myosin head to come up here and grab the actin filament, okay? So now what we're gonna draw, I'm gonna shrink my drawing a little bit here. Okay. Is our actin filament, and this time our myosin is going to be attached to the actin, okay? So go ahead and do this. Whee, that was an ugly line, or circle, I should say. Oh boy, it's just getting worse here. It's not getting any better. It's a good thing I'm not your art teacher. Okay. Isaiah, am I still frozen for you?
No, it's good now.
Okay. So what has happened? The myosin has come and attached to the actin. Nothing has happened yet. Our sliding filament here is still elongated. So for contraction to happen, those myosin heads are then going to have to flex and pull the filament closer together. Okay. So now, and then go ahead and redraw your myosin as well.
You froze for me a bit. Do you mind repeating it?
Okay, yeah, hold on one second. I'm drawing right now and I cannot multitask even slightly. Okay, so what has happened now is the myosin has dragged that actin closer together. We've taken our H zone here, which is not important to remember, and we've made this space smaller to contract the muscle. Okay. So relaxed, say 1, 2, oh, that is a horrible 2. 2, 3, relaxed is 1, and contracted is 3, okay? Just that way you guys have a little bit of a frame of reference, okay? You do not need to draw this 1, 2, and 3, okay? So now here's the trick though. In our drawing number 2 here, I had all of our myosin heads attached at the same time. That's actually not how it works. If you think about it, if everything contracted and pulled together at the same time, as soon as it relaxed in order to grab again, those actin filaments would slide apart again. So it's going to be more of a water brigade that does this. And what I mean by that, if in a water brigade or a fire brigade, you pass the bucket from one person to the next. Same thing with the myosin. It's going to grab and pull and grab and pull, and it's going to keep doing this versus just grabbing and pulling all at the same time, okay? This is just a simpler way to show you how the muscle is contracting. Does that make sense, how the muscle is sliding and using the myosin and actin to contract? Okay, good. So when you contract a muscle, It's all or nothing. Okay. And what I mean by that is it's not the amount of exertion that we are putting in. We can kind of flex, no problem. But what we are going to do is if this muscle fiber is going to contract, all of these actin and myosin are going to be contracting and moving. It's not just some of it. Okay. I'm going to clear. Everybody have this drawing so that I can clear it. Okay.
Mr. Q,
Yes, Aaron.
what was the difference of like number 2 and number 3?
Okay. So if you see the distance here between the ends of the actin, okay, they're much further apart here. So here the myosin has grabbed the actin, but here they have actually pulled those actin ends closer together.
Oh, I see. Thank you.
Uh-huh. Good question. Any other questions? Okay.
Wait, can you hear me or no?
Yeah, is this Clara?
Oh, yeah, okay. So from going to number 2 to number 3, you didn't put like the little dots. So does that mean that they like were let go or?
No, they should be there. I'm just not a good enough artist that I just didn't draw them.
Okay.
Okay. All right. Now then, on that Google Doc, there's this image. What I would like you to do is I would like you to label the muscles. Okay, these are the major muscle groups in the body. Now, before you go, for today's assignment, there was 4 images on the Google Doc. Okay, I would like you to label all of them in your ISN. Okay, label the list accordingly. So the first one was the bones of the skeleton, 1 through 18. Then you could have pieces of a long bone, pieces of the vertebrae. Okay, put a title so that I know what you are labeling. Okay. Then for the muscles, the last one, muscles of the body. After you label them, I want you to research and find their primary action. Some muscles will do a lot of different things for us, but I want you to find the primary action for these muscles only, not all the muscles in the body. Okay? Once you are done labeling all 4 images and you have the muscle actions, take a picture of your notes and turn them into Google Classroom for today. Okay? Does everybody understand what you're supposed to do for today?
Where's the Google Doc? Is it on Classroom?
It's on Classroom and it's under this week's topic.
Mr. Q,
Yes, Braden.
like the first exercise we did, like the 1 through 18.
Uh-huh.
I wrote like 1 through 18, just wrote it. Do we have to like draw the diagram and label
No.
them again?
No, please don't. I would not expect you to do that. So just write 1 through 18. That's totally fine.
Okay.
Once we get back into class in person, we'll have a couple of days where we go through these and put them into our ISN and we make it look pretty. So you're doing all 4 of those diagrams on the Google Doc. Okay, all 4 of them.
Is the Google Doc supposed to be under the bones and muscles assignment?
Yes.
I don't have anything attached on mine. I don't know if it's different for other people.
Okay, let me stop sharing my screen. I probably made a mistake with that. Yeah, totally did. Okay, hold on 1 second. That could be why this is a little confusing. Okay, guys, now go ahead and try to refresh. So under the bones and muscles, there's a document called Diagrams for 921. Okay? Okay, so if you guys don't have any questions, feel free to take off. I will see you on Wednesday. Have a good day.
So, Mr. Q,
Yes, Aaron.
so on the Google Docs, so are we just looking at the, like, we don't have to do the 1 through 18, but we do like the other ones and then write it down in our ISN?
So you already
Just like
did
the
1 through
numbers?
18.
Right.
So then you're just going to keep going with the rest of them, and you're going to do all of them in your ISN.
All right. Just like write the number, write the name of it, right?
Yep.
Okay. All right. Thank you.
Uh-huh.
Have a good day.
You too.
Thank you.